The initiation is to use artificial intelligence to control your insulin. Day to day, we always adjust insulin. Doctors in private setting, in government setting. But the limitation is you need a doctor or a nurse to adjust. Yeah, so it will be like an apps. Yeah, it will connect to us as well as a doctor to monitor. Yeah, so basically, patient put the sugar, check their sugars, then input the numbers in there. And then the app will tell them how much insulin to take. But I think the important is one, convenience to the patient. Instead of come to see us every so often, they can do this on day-to-day basis. We get to the target sugar to the target quicker. Too high we bring down to normal. Too low, then we avoid the low, bring it to normal. I think this is the beginning of the future of how the diabetes is going to be managed. I think the first phase is only adjusting certain numbers of one part of the sugar management. So hopefully after this, we can enhance the program to tackle different aspects of diabetes control throughout the day.